welcome. So we're going to meet with a couple of the staff first, and then we're going to meet with the doctor in a minute. But just want to go over what you guys offer, and maybe you can tell us a little bit about yourselves.
My name is Gerardo. I am like the technician optician. Some of my activities here are, according to people who come and visit us, I have to explain to them or guide them in how to find the right frame for them, the right fit. We have to consider a lot of specs and technical stuff about the frame, and also the type of material. I'm going to guide you through the different options, obviously the one that suits your needs better, and help you choose according to what you're willing to invest in your vision or what are your specific needs.
One thing I liked here is that you don't push people you let people pretty much choose among the options that they want. You explain what they might need.
Yep.
But then they can look at the price and determine what's going to meet their budget and what they feel most comfortable with.
Yep, that's what I like to help people to find and try new technologies. And obviously I can even show them, this is what you've been using. This is already an extra performance to what you want, and this is how far you can go. They always ask me what's the difference between one and the other. Always glad to answer those inquiries. But the main idea is to start using the newest technology available.
So Gerardo, one of the other services you offer is if people maybe haven't even visited before, but they have damaged glasses or need a repair or that type of thing. It's another service you offer, right?
Yes, we can deal with broken frames, twisted frames, dirty frames. There's a lot of adjustments we can make to frames or replace pieces. Most of the times we need to replace those nose pads. They become dirty and they cause eye infections, so it's really important to replace them eventually. Once you see them, they start changing color. It's better to bring them over, get new ones.
Yep.
They're not expensive. So.
Yeah, so people can come in if they like right off the street, because you're super handy to the area here.
Yep, I've even worked with hearing aids, watches, remotes. A lot of people bring over a lot of stuff, and I'm always glad to help.
Great. Well, thanks. We're now here with Leah. She's like the face of the business because she's the first person you'll probably meet when you come in the door, and also if you're calling in by phone or making a contact by computer. So nice to meet you again.
Hi, nice to meet you again.
Maybe tell us what you do here at the Optometrist.
I'm usually the one picking up the phone or managing you guys' orders. Most of the times when you guys come in, I'll be the first person you talk to. Whether it be by the phone or a text or through our email. I'm mostly in charge of managing our schedule. So the doctor's schedule, I manage, whether it be the appointments, if you guys need like an emergency or something. I'm usually the one you guys talk to.
Okay, thanks so much, Leah.
No, you're welcome. It's always nice talking to you.
Hey doctor, nice to be here in your office with you.
Thank you for visiting me and allowing me this space.
No problem. Except today I don't need to be here for your eyes, my eyes. We're going to have just a quick chat about your business and how it works, why people come here instead of going directly, as you said, to an ophthalmologist. Why should people come here to see you first, whether it be just for glasses or to see if they want contacts or whatever that they're looking for, and maybe just explain the services you offer and why you're different than, say, other people in the area.
Yes. See, when I finished college to become an optometrist, I was able to go to school in Guadalajara. So when I finished that, I was looking for a place where to settle and start seeing patients. So because I'm bilingual, I decided to come to this area, Ajijic. I also already had some friends around here. But long story short, I came to realize that all the places around here, the optical shops, did not have a licensed optometrist.
Okay.
Sadly, we live in a country that doesn't enforce law all the time. We have the laws, and by law you should be licensed. But reality is different, right? So there's a lot of places that sell glasses, and they basically have opticians calling themselves optometrists. Okay. So I'm not gonna lie, I was a little disappointed when I got out of school to find out that's the way it worked. And especially because these were people that were not charging for the eye exam. They had a free eye exam. that was hard for me because I came in charging for my consultation. In fact, I had to change the name. I don't call it an eye exam. I call it an eye consultation. So my fees right now are 400 pesos to come to see me. Why would you want to come to see me first before seeing the ophthalmologist? Well, first of all, because that's how medicine works. You have to see a first level care physician first, and then if this physician or doctor or licensed optometrist in my case thinks or finds that you need a second level care, like an ophthalmologist, ophthalmologists tend to have a specialty and a subspecialty. Yes, I can give you glasses. Yes, I can give you contacts, but I can also treat allergies. I can treat infections. I can help you find out if you probably have glaucoma, if you're developing cataracts, if you have macular degeneration. All the staples and all the main things that people are concerned about, I'm checking to see if there's a possibility you have them. Now, I will say, I'm going to be humble about this. We can miss things even by looking. So what if you're not looking? That's even worse.
Right.
Especially with glaucoma. The most common form of glaucoma is called a wide-angle glaucoma, also known as normotensive glaucoma, meaning these are patients that have a normal pressure in their eyes, because that's one of the tests we give you here.
Right.
We check your pressure.
Right.
But we have patients that have normal pressures, meaning it doesn't make you think of glaucoma. But guess what? This patient does have glaucoma. It just has a form that is not easy to find.
It doesn't show up easily.
So that's where the clinical eye goes into play.
Right.
And the experience and knowledge. Very respectfully, I will say, if you were only trained to set glasses like an optician, if you were only trained to put lenses in there in front of people's eyes and ask which one's better, I'm afraid you're gonna miss it, because I could miss it.
Right.
But I am trained for finding it.
And if you do miss it, you can end up blind. You can end up
Yes.
with major issues.
That's right. We have that responsibility in our hands.
One of the things I wanted to ask you is, because in this area in Ajijic, of your clientele, I assume of the Americans and Canadians and Europeans that come in here, almost all of them are over 65 years old, right?
Yes, my demographics have played a very significant role in what I've been doing. Funny thing, when I got out of school, I wanted to do, it's called a postgraduate in contact lenses, and I also wanted to do pediatrics. But look at me here, doing geriatrics.
The opposite,
right? Yeah, the complete
but
opposite.
But at the same time, because you're dealing with older people, these issues with the eye is going to be more prevalent, right?
The prevalence is higher
right.
for those that I mentioned.
Right.
Glaucoma, cataracts, macular degeneration.
Right.
In fact, those are the three main things we're always looking for.
Yeah.
And I will say that when it comes to cataracts, it's a little more, I'm going to call them normal, because we can all get cataracts. And worst case, these cataracts develop and you require a surgery.
To get them removed, right? That's it.
You can basically put it all back to I would call it a factory setting. Whereas glaucoma and macular degeneration, if you lose any percentage of your vision, it is more than likely gone forever.
Right.
Now, back to the demographics and my patients being, most of them over 60, I cannot do this myself. I have had to ask for help from other specialists, so much that I have an in-house retina specialist. So my message to my current patients and potential new patients is, give me a chance. Give me a chance. I want to show you what I'm capable of, and I want to show you how passionate I'm about eyes in general.
Right. Yeah. Well, thanks, doctor.
Thank you.
That was great.
Thank you for everything.